right, you guys, it is time for your health check. No vote on boosters, but a CDC advisory panel met for 6.5 hours yesterday. I listened to the whole thing. They were there to hear the latest research on Pfizer's COVID-19 vaccine effectiveness. They left about 45 minutes at the end for discussion on if and when we're going to need booster shots. So the panel says right now the overall effectiveness of all the vaccines, all three of them that we have available in this country, haven't dropped much, so you're still probably pretty good. But the data needed, to properly evaluate booster shots for the general population is limited. Remember that. So we're going kind of month to month here. President Biden has laid out a timeline to make booster shots widely available by September 20th. That's in about 3 weeks. Additional doses have already been made available to those high-risk populations, so older adults, people living with chronic diseases, and healthcare workers. But the panel's consensus still remains priority should be to get unvaccinated Americans their first shots before the rest of us need to concern ourselves with boosters. McDonald's may close down indoor dining as the Delta variant spreads. Reuters reporting the company recently laid out plans. This move would happen in regions seeing severe outbreaks. It would be a blow for the Golden Arches. Sales went up after restaurants reopened to indoor dining. You know who would be happy about it, though? This health reporter. All right. France is upping its COVID precautions. I'm going to get in trouble for that, I have a feeling. Nearly 2 million people in restaurants and other service jobs must now show their coronavirus health pass to go to work. The general public is already required to show the pass to enter restaurants, tourist sites, and many other public venues. Finally, has this pandemic made you less active, working from home, sinking into the sofa? Well, researchers writing for the British Journal of Sports Medicine have figured out how much exercise you need to offset a 10-hour day of just sitting. Around 40 minutes of moderate to vigorous intensity physical activity should do it. And of course, any amount of exercise, as I've told you for the last 6 years that I've been a health reporter here, Greg, or even just standing up helps. You've heard me say that, right?
I've heard you say that.
A time or two?
Yes.
You know, just for the folks in the back, a little louder. But yeah, standing up, walking around, that helps. You know what they didn't talk about, though, in that study is the fact that moving also helps with those aches and pains. I know that every once in a while, Greg likes to stretch over there.
I do. You got to keep moving, because if I sit still, I might fall asleep over here at some point. So try to stay awake best way I can.